Cervical cap, how to use this contraception. Imagine a small silicone or rubber cup that fits snugly over your cervix to help prevent pregnancy. That's what a cervical cap is. It's a barrier method of contraception designed to block sperm from entering the uterus. To use it correctly and effectively, you need to follow some important steps. First, a healthcare professional must fit and prescribe the right size for you. The cap comes in different sizes based on whether you have never been pregnant, have been pregnant without vaginal delivery, or have had vaginal childbirth. Getting the proper fit is essential for comfort and effectiveness. Before inserting the cap, wash your hands thoroughly with soap and water to keep everything clean. Next, apply spermicide inside the cap. You should put spermicide in the groove between the rim and dome, inside the bowl, and on the outer surface of the cap. The spermicide helps kill sperm and increases the chance that the cap will prevent pregnancy. When ready, fold or squeeze the cap so it can be inserted into the vagina. Push the long brim first, then position the cap so it covers your cervix completely. It should create a gentle suction to stay in place. You can check by pressing on the dome to ensure your cervix is fully covered. Timing is important. You can insert the cervical cap up to 15 minutes before sex, or even several hours beforehand, depending on your comfort. Some guidelines say it can be inserted up to 40 hours before intercourse. After sex, leave the cap in place for at least 6 hours to make sure sperm are immobilized. Do not leave it in longer than 48 hours to reduce the risk of infection or toxic shock syndrome. If you have more sex within this period, you do not need to remove the cap but should add more spermicide before each act. When it's time to remove the cap, gently break the suction by pressing on the dome, then pull it out carefully. Wash it with mild soap and water, rinse thoroughly, and let it air dry. Store it in its case in a cool, dry place. Avoid using oil-based lubricants or creams that can damage the material. There are some precautions to keep in mind. Do not use the cervical cap during your period if you have vaginal or pelvic infections or within 6 weeks after childbirth. It does not protect against sexually transmitted infections like HIV, so always use condoms alongside it if you want protection from STIs. The effectiveness of the cervical cap varies. When used perfectly, it can be about 80 to 90% effective for women who have never given birth vaginally. For women who have had vaginal deliveries, effectiveness drops to around 60 to 70%. Keep in mind that typical use, which includes occasional mistakes, results in higher pregnancy rates. Consistent and correct use is key to maximizing protection. There are some small risks, such as toxic shock syndrome if left in too long, so it's important not to keep it in for more than 48 hours. Avoid douching after removal, as it can upset your vaginal balance. Always consult your healthcare provider for fitting, detailed instructions, and if you experience discomfort or signs of infection. Using a cervical cap takes practice and comfort with insertion and removal, but it's a non-hormonal option that fits well within barrier methods. Remember, for protection against sexually transmitted infections, always use condoms in addition to the cervical cap. For personalized advice and safe use, talk to your healthcare professional.